Okay, let's get started. We're doing a deep dive today focusing on microcephaly. And we're working from some pretty dense revision notes, the kind designed to be really high yield. So the idea is to pull out the key info, make it clear and quick, perfect if you need to get up to speed fast, maybe for your revision, that sort of thing.
Exactly. These notes are great because they really condense it all down. They start right off with the basic definition.
Okay, so what is microcephaly? According to these notes, what's the core definition?
Fundamentally, it's defined as a neurodevelopmental condition. The main feature is an abnormally small head circumference.
And there's a specific measure, right?
Yes, the notes are very clear on this. It's the occipital-frontal circumference measuring less than the second centile that could be flagged at birth or sometimes in early childhood. That measurement is really key.
Less than the second centile. Got it. Okay. Now, the notes seem to group together etiology, causes, and risk factors. Sounds like different angles on why it happens.
Pretty much. They lay out a whole spectrum. Risk factors are, things that increase the chance, like infections the mother might have during pregnancy, maybe exposure to radiation or certain chemicals or a family history, genetic factors.
Right. And the direct causes.
Yeah, the causes are more specific triggers. The notes mention genetic abnormalities, prenatal infections. Zika is given as a notable example here.
Zika, yeah, I saw that mentioned.
Also exposure to toxins or drugs and certain genetic syndromes like Patau syndrome.
And it doesn't stop there, does it? The notes also bring in fetal alcohol syndrome, brain injuries around birth.
Perinatal brain injury, yeah.
Yeah.
And interestingly, they also list normal variations. Sometimes it just runs in families without being pathological. And craniosynostosis.
Ah, yes. Craniosynostosis, where the skull bones fuse too early.
Exactly. That premature fusion can restrict the brain's growth. So, you see, the notes really emphasize it's not just one thing. It's a variety of factors that mess with early brain development.
That variety is really something. How do the notes explain the pathophysiology? Like, how does the disruption lead to the smaller head?
Good question. The mechanism.
Hmm.
Well, the notes keep it concise. It's basically down to abnormal brain development. So there's reduced growth of the actual brain tissue, and because the skull grows in response to the brain's growth, if the brain grows less.
The head circumference stays smaller. Simple connection, makes sense. What about how common it is? Epidemiology. Any figures for the UK?
Yes. According to these notes, the UK prevalence is roughly 1 to 2 cases per 10,000 live births.
Okay, 1 to 2 per 10,000. So relatively uncommon.
Seems so based on this source.
Right. Let's think about clinical features. What would someone actually experience, or what signs would a doctor look for? Symptoms first.
Well, the most obvious symptom is the small head size itself.
Yeah.
But critically, the notes point to developmental delays, things like intellectual disabilities and holdups in developing motor skills and speech.
Okay. And the signs, things you'd observe clinically.
Yeah, the signs noted are delayed cognitive development. Seizures are a big one, a significant neurological complication. And the notes also mention facial abnormalities. But they do stress, importantly, that this isn't always present. It's more common in some cases, often linked to a specific underlying syndrome.
That's a useful distinction. Okay, so could it be confused with other conditions? What about differential diagnoses?
Definitely. The notes highlight a few key differentials to consider. Specifically, they mention familial microcephaly, the type that runs in families without other issues. Also, syndromic microcephaly, where it's just one part of a bigger picture, a larger syndrome. And then just generally other genetic or acquired conditions that might affect head size or development.
Makes sense to rule those out. So if there's a concern, what investigations do the notes suggest?
It follows a logical path. Starts with accurately measuring the head circumference, obviously. Then, to figure out the why and see the brain structure, neuroimaging is crucial. They list ultrasound, CT, and MRI. Genetic testing is also key, given how many causes are genetic. And blood tests, too. Useful for checking for infections or metabolic disorders mentioned in the notes.
Okay, quite a thorough workup. And management. How is it handled based on the UK context in these notes?
The emphasis is very much on a supportive approach. It's about supportive care and, really importantly, early intervention services.
Like therapies.
Exactly. Physical therapy, occupational therapy, speech therapy tailored to what the child needs, and, of course, treating any specific underlying cause if one's identified.
So supporting development, managing issues, what's the general outlook, the prognosis?
Notes are very clear. It's extremely varied. It really hinges on the underlying cause and how severe any complications are. They do mention the potential for lifelong developmental challenges.
Which leads us to complications. What are the main ones listed in the material?
The big ones noted are intellectual disabilities and those ongoing developmental delays we mentioned. Neurological problems are common too, particularly seizures and movement disorders. Vision and hearing impairments are also listed, plus the potential for other associated medical conditions, depending on the root cause.
That really pulls it all together from these notes. So for anyone revising, needing that quick grasp, these are the nuggets, right? The definition with that specific centile, the wide range of causes.
Yeah, the key clinical features, the investigation steps, the supportive management focus.
Those are the high yield points from this source material.
Exactly. Getting a handle on those specifics gives you a really solid foundation.
So thinking about all this, here's something to mull over based on what we've just discussed from the notes. We heard how varied the prognosis and complications can be. So how much difference does the timing really make? How uniquely does getting that diagnosis early and starting those interventions quickly shape the life trajectory for a child with microcephaly?
It really does underline the importance of that early identification and getting support in place, doesn't it?
Absolutely. Well, that wraps up our deep dive into microcephaly, using these revision notes as our guide. We hope that quick overview helps clarify things for you. And if you're looking for more resources for your studies, especially for the MSRA, do check out pastthemsra.com and also freemsra.com.